So check this out. This is what came out of a ganglion cyst. Tune into this video if you want to see how we get this out of this person's foot. So you can see there's a small cyst on the side of their foot. We use an 18 gauge needle after we numb up the foot. The needle gets inserted into the cyst and then we're drawing out. You can see there's a lot of pressure in the syringe and we're trying to suck the fluid. It's not coming, so then we apply some pressure to the cyst itself with our other hand. And I'm using my thumb to put a lot of pressure. This is very thick, viscous synovial fluid. It's very difficult to get out. You'll see some practitioners will actually make an incision in the foot and drain it like they're making an incision and drainage of an abscess even. But I like to go in with an 18 gauge needle and force the fluid out through that needle. We have a lot of negative pressure in that syringe and we have drawn out as much of the fluid as we can. And I always double check. You can see I'm getting a little bit more out by applying some manual pressure onto the foot, and we're forcing that thick, viscous synovial fluid out. See how it's real viscous and almost sticky and slimy? We'll wipe that away, and then the next step is to insert dexamethasone. This is a steroid which can help reduce the inflammation and hopefully stop this cyst from filling back up with synovial fluid. So as you see, I'm inserting that dexamethasone. The cyst kind of fills back up and that'll resorb over time. And the goal is to have that dexamethasone reduce the inflammatory reaction of the lining of that synovial cyst or ganglion cyst, and it'll help prevent it from coming back. And then this is a simple in-office procedure. After we're done with that, a Band-Aid goes on over that hole. We leave it on for 24 hours. The patient can get it wet after that, and hopefully this fixes it. So if you want to see what this looks like, synovial fluid that are in these ganglion cysts are very thick and viscous. This is very classic when you remove a cyst like this. This is what you'll see. And we will send this away to pathology, but I always show an example to the patient to let them know what it looks like if they want to see it and how we remove that viscous fluid. Very classic. This is what you want to see if you ever drain a ganglion cyst.